We're here. We're going to be doing a normal childbirth today. Practical on this patient. BSI. I got my gloves on. I got all my appropriate PPE that we're going to be using for childbirth. We've already checked all of our equipment. We have all of our equipment ready. This is our patient, and we'll proceed like so. We'll check the patient for the contraction, the intervals. They're at 1 or 2 minutes, so we know we got delivery here real soon. We'll ask the patient how the contractions feel, how hard they are, or how they're feeling. See if they're real labored and whatnot. And they are. So what we're going to do is we're going to support the patient. We're going to check the patient for crowning of the baby, which we do have. We have our PPE on. We're just going to, like I said, we're going to get ready for delivery. Ask the patient how many children they've had, if this is their first child or if this is their 4th or 5th child, or however many they've had. And like I said, we'll do that. We'll support the head of the baby like so, getting ready for delivery. Ask the mother to push with each contraction that she's having, and as the baby is coming out, we'll make sure not to do anything that's going to hurt the baby as far as pulling or pushing or moving the baby in any kind of destructive type of way. And upon seeing the baby's head, we will suction the airway, making sure that no kind of meconium or anything has come out as far as that with the amniotic fluids. We'll suction the airway in the mouth, and get any kind of fluid out in the nose, make sure kind of get any fluid out of the airway, making sure that the baby looks, make sure it's got good color, make sure to see if it's crying, anything like such. And upon visualization of the umbilical cord, we'll measure 15 centimeters out, and we'll use our clamps. Our sterile clamps, we'll clamp it at 15 centimeters, and we'll clamp it again at 10 centimeters, wait for it to stop pulsating, and we'll use our scalpel, and we'll cut the umbilical cord. Once the baby is fully delivered, we'll take the baby and we'll dry it off. We'll wrap it in a blanket and make sure it's warm. We'll check the extremities. We'll check the apgar, the appearance, grimace, the pulse. Check the pulse, making sure that it's at an adequate rate. We'll check the respirations. Make sure the respirations are at an adequate rate. We check the activity. Make sure the baby's crying like it's supposed to, active. Checking the extremities. Make sure they're not no signs of hypoxic or cyanotic or anything like that. And it's a 9 or a 10. So once the baby's dry, we check the SpO2, check everything like that, check all the vitals, make sure they are good. I will take the baby and turn the care over to my professional partner, which they have, and we'll get ready. We have our sterile dressings, and we'll place that around the vaginal area and up under to catch any kind of blood or anything that discharges from. And we'll get ready to deliver the placenta. We can do a uterine massage to help with the delivery of that. We have our bag here. Once the placenta has delivered, we'll place it in our bag and we'll wrap it like so and dispose of it properly. We'll check the vitals and everything on the mother, make sure everything is within normal range, making sure that she's good and like she's supposed to be, and alert and everything, and just check her, make sure that she's wrapped up warm, and we'll we'll transport to the hospital as quickly as possible and done with the station.